You were about to talk about wasting syndrome. Could you talk about that? And it's one of those words that's kind of hard to say for some folks. Help us out with that.
So it's cachexia is the pronunciation. Cachexia, wasting syndrome. Um, Again, this is a symptom, and it's part of the disease, the pathophysiology usually of end stage cancer in particular, but it can also be seen in end stage AIDS and other severe disorders where especially the immune system is trying really, really hard to fight back on something at the very end, and it's essentially breaking down muscle mass within the individual and feeding itself, the immune system or the cancer, with sugar, because amino acids in the muscle turn into sugar. So the keynote is you're going to see their face is very drawn. You can kind of see the skeleton under the skin. They're very underweight. There are certain things we'll see on labs, but also they're not going to be hungry. So they're going to have anorexia, and they're not going to want to eat, but they have to eat because the whole point is that they're wasting. So with that, this is another situation where we're going to want to stimulate the appetite, and THC is a big part of that. They may or may not be nauseous, so the same recommendations for nausea may or may not apply, but you really want to increase the appetite. Best way to do that is THC, or again, delta-8 THC. And if they're cachexic but not nauseous, high oral doses, but also inhaling as much as they need to. And again, you can consider rectal suppositories in this situation to bypass first pass metabolism in the liver and distribute it to the other tissues, especially with that delta-8, so that the liver isn't going to alter the molecules. But whatever way you can get it in for them at very high doses is appropriate. So beta-caryophyllene and limonene are also, because of the anti-nausea effects and the immune modulatory effects, would be what I would recommend terpene profile-wise. And if the person has cancer, you're in dicey terrain already. If they're cachexic, it's often a one-way street. It's very difficult to pull somebody back from cachexia. But dietary factors here are extremely important. If they do have cancer, even if they have AIDS, conventional medicine will just give them Ensure, which naturopathic oncologists absolutely hate. So I would recommend, if possible, especially if they have cancer, I don't know how much you can sort of push this within the retail space, but a naturopathic oncologist, if there's really any hope for reversing the cachexia, they need to do very specific dietary things as well. So yeah, a naturopathic oncologist will know more than a conventional oncologist in that way, dietary wise. Don't expect that the cannabis is going to necessarily reverse it, but if we can get them to eat and get enough nutrients in, then and if we can get rein in whatever is causing the cachexia, it might be reversible, but it's already, things are pretty bad at that point. So it's more so just to keep them comfortable and maybe slow things. So again, I said with cachexia, usually there's anorexia. Anorexia just means lack of appetite. We're not talking about anorexia nervosa, the eating disorder necessarily, but I'm going to go into that a bit here too. So with anorexia, like I said, with cachexia, you want to stimulate the appetite. Anorexia happens in a lot of diseases. Again, cancer is very common. So you want to stimulate the appetite. THC or delta-8 is going to be important for stimulating the appetite. If the person does have anorexia nervosa, I would avoid high amounts of THC because it can make them a little more panicky, a little more neurotic. So in that situation, I would want them to have a higher CBD ratio, like 10-1 or 5-1 CBD to THC, because if it's anorexia nervosa, I want to stimulate their appetite, but I want the sedative effects of the CBD versus the THC. Also for anorexia, CBG and CBN, I would say, are really important. CBN in particular, if it's anorexia nervosa, because it's sedative, but CBG is a big one too. And then for this also, oral dosing, absolutely, and potentially considering rectal suppositories here as well. If they're anorexic, so they have no appetite, but they're not nauseous, then you could also do, or those ways, if they're anorexic and nauseous, inhaled would be probably the best route here. Same terpenes, beta-caryophyllene and limonene. And for anorexia nervosa, obviously that's a complex psychiatric condition. They're going to need other support. But really in that situation, if cannabis is working for them, cannabis assisted psychotherapy, if there's anybody who's doing that, could really be pretty life-changing, or any psychedelic assisted psychotherapy could be pretty life-changing for somebody with anorexia nervosa, in particular, the eating disorder.
Thank you for bringing, and I know those are real, you've really helped pare a very complex situation down. And so, once again, in the retail space, we're never pretending to be a doctor or have the answer to anything, but it's really important to be familiar with these conditions, not only so that you know what they are, but so like some of the symptoms, some of the complications that go along with them. Ironically, strangely, the very thing that people have long made fun of cannabis about, giving you the munchies,
Right.
is the very thing that has brought cannabis back to the forefront. In 80s, in the 1980s with AIDS and cancer patients, realizing, hey, this improves my, not only improves my appetite, but in the case of AIDS, was allowing people to remain on their antiretroviral drugs, their art therapy drugs that would make them just really sick and have no appetite.
Right.
But they found that people who are using cannabis were able to stay on that medicine and get some relief, even though we've evolved from maybe what people were taking at the time. But so it's amazing how, once again, things come back full circle.